Everyone, Colin Egglesfield here, and I am here with Dr. Ramon, who is the medical director for R3 Stem Cell International for the Tijuana clinic and also the Cancun clinic. And you guys all know Dr. Green, the founder and CEO of R3 Stem Cell. And Dr. Ramon, how did you meet Dr. Green? How did you get into the whole regenerative medicine arena?
Well, I met Dr. Green at an R3 stem cell training in Las Vegas a few years ago. I was already working on stem cells. I've been working with stem cells for the past 6-7 years now. And I was fortunate to go to Dr. Green's training, and we just hit it up, and we had a little idea of bringing a clinic that would be reachable by anyone. As you know, stem cell treatment is very expensive. So our idea was to open up a clinic that was more focused on the normal person that we can actually afford.
So as far as the whole science behind regenerative healthcare, what would you say is benefit to regenerative health, and why do you think doctors have been a little bit hesitant to fully embrace it as of yet?
In reality, we weren't taught what mesenchymal stem cells are in medical school. So most of the doctors and mainly speaking the older generations like myself were taught that stem cells are part of the embryo.
As compared to a mesenchymal stem cell, which is from the umbilical cord.
Precisely, from other tissues. So a mesenchymal stem cell is an adult cell. It's already pre-differentiated. When you talk to a doctor that doesn't know what a mesenchymal stem cell is, most of the time they'll go back to embryology 101 when we were taught about embryonic stem cells. Now, we know that embryonic stem cells have a lot of problems. So there's the moral problem, there's the ethical problems, and then there's also scientific problems. We don't have that with mesenchymal stem cells. So mesenchymal stem cells, in fact, are medicinal signaling cells. So they keep the nomenclature, so it's MSCs, but now we see them as a signaling cell. So they bring the genetic information that the tissues need in order for them to repair. And to do that, it does three very important things that make them very useful, for medicine. So one of them is immunoregulation, modulation of inflammation, and angiogenesis. So those three functions make them very useful for a lot of medical purposes.
In other words, they boost your immune system?
They modulate your immune system, so it can boost it or it can quiet your immune system, depending on what you need.
Okay.
But they also do that with inflammation.
Right. You obviously have a medical director, as we mentioned, for Cancun and for Tijuana. You're seeing a lot of patients coming down now from where?
99% of our patients come from the US and Canada. So right now in the Tijuana clinic, we're mostly seeing people that live west of the Rockies.
And what kind of patients are you seeing down in your clinics?
So we see the whole spectrum of regenerative patients. So anything from aesthetics and longevity, and then all the way to chronic conditions, autoimmune conditions, neurological conditions, to the more chronic side. So anything in between, we see all types of patients.
So how do people find out about the clinics down in Mexico?
We have extensive marketing in social media, YouTube channel. I think we're one of the highest ranking stem cell information sites in the web right now.
And where are the stem cells being sourced from?
The lab in Mexico sources them from different tissue banks. It can be from the tissue bank at UCLA or Mexico City. The umbilical cords that we use are sourced where we can find the best ones, and then they're processed in our lab in Ensenada.
So bottom line is stem cells are tested rigorously, they're safe?
They're very safe. A lot of people have a misconception that there's a problem with the FDA or the medical agencies around the world against stem cells, and that's not the case.
Can you share with us some of the success stories that you've seen from administering stem cell therapy to your patients?
Wow, it's a long history. One of the first cases that we treated was a Canadian patient that his rheumatoid arthritis had his hands very deformed already. So we did the infusion. It was a very small infusion. I think it was 50 million, and it's rather small for rheumatoid arthritis. It was one of the first patients we started using the exosomes as well, in the treatment.
Mm-hmm.
And he sent us a series of pictures about a month after. His hands were straight.
Really?
And he was showing us how he was able to make a fist with both hands.
Wow.
Where he would tell me that it was a couple of years since he was able to make a fist.
Wow. That's
So
amazing.
that's a great success story just there. But I mean, we have tons of them, and we have tons of testimonials from patients that they just send us their pictures and their testimonials. They call us. We have tons of videos. I mean, one of the reasons I'm in this field is because it's very fulfilling. It's something where you're helping people. People are getting better.
Yeah.
It's just a win-win all over the place.
Yeah. And that's why I'm excited to be a part of R3 and to share all this amazing news and just to be meeting so many people who are benefiting from stem cell therapy. And for people who are interested in receiving stem cell therapy, what's great about going down to Mexico is that in Cancun, there's going to be, we're doing these vacation packages where you can come down to Cancun, stay at either a 5-star hotel or a 3-star hotel, and come and visit Dr. Ramon at his clinic down in Cancun or in Tijuana. And if they want more information about how they can set up an appointment, can you tell us a little bit about how that process works?
It's very easy. So like I mentioned earlier, we have tons of marketing. We have tons of video. We have our website. It's really easy to find us online. And the process is, once you show interest, somebody gets in touch with you. They schedule a phone consultation with one of our physicians. So we have several physicians that do phone consultations or Zoom consultations, depending on the case, with our patients to decide if they're a candidate for the procedure, and if they are, to get all the information needed to prescribe the number of cells that they need. So after that phone consultation or Zoom consultation, they put them in touch with our concierge service, so our logistics department, which takes care of setting you up with our drivers. Because if you come to Tijuana, our driver will take you from San Diego to Tijuana and back. You don't have to worry about the
White glove service.
Exactly. You don't have to worry about the border or anything. Our purpose is to help you all the way from when you get here till we put you back on your plane.
Okay.
And in Cancun, they'll pick you up at your hotel, take you to the clinic and back. So you don't have to worry about how you get there or anything like that. And at every moment, we're there to help. We have our logistics department for that. And then our once you get to the clinic, our medical team takes care of it. Depending on what you're gonna get is the type of doctor. We have specialists for all the procedures that we do.
And the stem cells that people are receiving down in Mexico, they're the same stem cells that they would be getting in the United States.
Absolutely.
Same process, sourced the same way.
Absolutely. Regulations are as stringent, if not more, in Mexico than they are in the US. So doing stem cell treatments is a very serious specialty, and it's heavily regulated. So, and I think one of the reasons we've had so much success is because of the high quality of what we do. We take very good care of getting the highest quality biologics. We put them through a lengthy process of analyzing and just making sure that the patient's getting the best biologic. And also with the physicians that work with us, the nurses that work for us and all of that. We're constantly training, constantly learning, and we're trying to keep that overall quality in all the treatments that we provide.
And if someone is interested in receiving stem cell therapy, now that R3 has clinic in Scottsdale and in Nashville, what would be the difference for someone wanting to come down to Mexico to get treatment as compared to Scottsdale or Nashville?
Well, the two main differences. So the reason we have our Mexican clinics is obviously for pricing. Stem cells are very expensive in the U.S. and it just has to do with overhead and it has to do with regulations. So the cost of production and treatment in Mexico is about a third of what it is in the U.S. So in pricing, it's a little bit more competitive.
Okay.
Quality-wise, it's the same.
Okay.
And another and the other reason is there's certain treatments that are not done in the U.S. Because of regulations that we're able to produce it in Mexico.
Okay. Awesome. Well, Dr. Ramon, it's been great chatting with you. I can't wait to go down to Cancun to visit the clinic. And if you want more information about coming down to Mexico and getting a treatment for yourself, you can go to r3stemcell.com or call 1-844-GET-STEM. Thanks, Dr. Ramon.
Thank you, Colin.